Chronic pain disables more people than cancer or heart disease. We'll discuss ways to cope with it and treat it. Up next on Comcast Newsmakers.
Bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
It's estimated that over 70 million Americans suffer from chronic pain, but this hour's newsmaker is here to share some new treatments to manage the discomfort. Dr. Ira Fox is president and co-founder of Anesthesia Pain Care Consultants. And thanks very much for joining us.
Thank you.
Now, you didn't start off as a pain manager, so to speak. You were an anesthesiologist.
Correct. My training is in anesthesia, and for a long time I was doing both anesthesiology and pain management. And about 10 years ago, the demands on the pain part of the practice became significant enough to where we've been doing interventional pain management for the last 10 years only.
Have you seen this increase as far as people needing treatment for pain management? And if so, why?
Well, I think the most significant part is people are starting to recognize that there's treatment available. And I spent my first 10 years or so helping a national group of people get the word out. And now people are actually understanding that there are options available to help treat their pain.
So people like resign themselves to the fact that this is the way my life is going to be, and now they're looking at hope.
Exactly. And I think one of the most important aspects of being a pain physician is to not only bring the human aspect of treatment to that patient, but always acknowledge that there needs to be hope.
Is the main problem trying to figure out why the pain is occurring?
That is number one. And I'd say as little as 10 years ago, myself and my associates were just a handful of people in the country who were doing all of these injections under fluoroscopy, where we can exactly know for sure the medication is getting to a certain spot. At that time, it was relatively new, and now it's the gold standard. Mm-hmm. I'm proud to say at Anesthesia Pain Care Consultants, when people ask what's new in pain management, it is very new, but we've been doing it for about 10 years. Mm-hmm. It's very exciting to see the results. We have patients who will testify they've been, quote unquote, given their life back, and that's very exciting. And it motivates you as a physician to keep trying to do more for these people where there was a time we were doing nothing.
Pain blocking, using a neurological type approach, is that something that you see more of nowadays?
If we can use these interventional techniques for diagnostic purposes as much as therapeutic purposes, meaning we know for sure that the pain is coming from a particular area, then we can incorporate other techniques, sometimes eliminating pain fibers, eliminating nerve areas that are responsible for pain, but most of the time medicating them and getting them to heal up and allowing the body an opportunity to start to heal and actually get into a physical medicine or rehabilitation program where we can now do things that you weren't able to do before and build yourself up slowly and get back into your routine.
I guess some people feel that if you give medication, sometimes the side effects of the medication is worse than the actual pain itself.
Correct, and especially in some of the elderly populations, they're taking pain medication. Next thing you know, they become disoriented, they could fall.
Right.
I think the interventional techniques a lot of times are a better option. And sometimes you end up having to do both, but the goal at the end is to have somebody who feels as though they're in control of their pain is not in control of them.
And that's not the case most of the time.
Well, when we're done, we hopefully have that most of the time, yes.
All right. Well, thank you very much, and keep up the good work. I know there's a lot of people out there that are looking to you as a light at the end of the tunnel. This hour's newsmaker has been Dr. Ira Fox with new treatments for pain management. I'm Spiro Canton. Thanks for watching.
The preceding has been a presentation of Comcast Newsmakers. And now, back to